Welcome to the Reinventing the White Coat podcast, where we delve into conversations aimed at helping you foster a healthy relationship with your career and yourself. If you're a physician feeling unfulfilled or burned out or want to prevent yourself from going down that path, then this podcast is for you. I'm your host, Jennifer Scher, pediatrician, chief wellness officer, and executive and life coach. Sit back and relax as we explore ways to live your best life and have a career in medicine. Today I have with me Dr. Jessica Cohn, who is a pediatrician and breastfeeding medicine specialist. Jessica, thank you so much for being here today.
I'm happy to be here.
So, it's actually funny how we connected. Right? And things happen for a reason. Jessica is a lactation consultant and really has a strong interest in breastfeeding. And I, for the large part of my career, did the same thing. And as I was sort of slowing down from seeing patients doing more wellness and other things, I was really looking to find someone to kind of help and somehow I can't even remember. It was something through Facebook, right?
Yeah. So I had sort of been looking for a way to get back into working. And I knew I had to kind of take a different path and some place that could maybe make accommodations. And so I reached out to somebody on Allied through a Facebook message. And then, and it was Dr. Firestein. And then she, we kind of discussed what I was looking for. And then she subsequently said, I think I know who to connect you with.
That is right. Okay. So that's my full disclosure here. So today's guest works with me in my office. So it's going to be a very personal conversation. So she did. She passed it off to me, knowing that I had such an interest in lactation. And so here we are. So before we get into, and I really, really wanted to have you to share your story of, you had this medical issue that turned you into a patient. But before we get into that, can you share a little bit about your journey to this point, why you became a doctor and, the big picture?
Yeah. So, I've always sort of been interested in how the body works and medicine in general. And when I was probably about 12, I had some unrelated medical issue that kind of made me more interested in how the body worked. I had a very close relationship with my pediatrician, and it sort of just kind of fell into place. And in high school, I became more interested in biology, taking AP biology. And then I ended up deciding, I can't see myself doing anything else. This is what I want to do. And I applied to a combined BSMD program through Stony Brook. And then it was sort of set that I was going to be going to Stony Brook for medical school.
Oh, wow. Well. You're one of those people who's decided super early.
Super early, yeah. And it's just always been like, I can't see myself doing anything else. So here we go. And it's been a journey, but, and then in medical school, I said, I'm going to keep an open mind. I know I want to do pediatrics, but let me see everything else. And it turned out that I did want to do pediatrics and I stuck with it. And then even in residency, I knew, pretty early that I wanted to do primary care. And so, a lot of this has sort of been, keeping an open mind, but also understanding that this is really what I want to do.
Yeah. Deciding something at 18 years old for the rest of your life, though. I mean, I think about decisions I made at 18 and with such like, oh my God, do you have any regrets that you decided so early, or this was just?
No, it's always funny because people say, like, how did you know in high school that this is what you wanted to do? But I really, this is what I never sort of tried anything else. This is what I wanted to do. And it's a long path, yeah, but it worked. And then going into primary care, it's just something that I've really, I found so rewarding. And my style of medicine to sort of, really connect with families. And I love seeing everybody grow up and supporting families through some of the, really tough times in life, but also all the happy times. And so
it is such a rewarding specialty.
There's nothing
Pediatrics
like
is the
it.
best. So where were you working after residency? What were you doing?
So I moved to Ohio after residency because my husband was in fellowship there. And I started working in a private practice. And it was some of the best training I ever had because we did inpatient and outpatient. We managed our own patients in the hospital. We did newborn rounding, and I was fresh out of residency. And I just sort of, got to really see it all and do it all and learn, as you probably remember, you come out of residency, you feel like, I don't know anything. How am I going to do this? And so it really kind of just threw me in there. I learned so much, and I was there for a few years. And then it was with, I sort of had to make a decision because I wanted to start a family, and I knew the intensity with which I was working was not going to really jive. So I ended up leaving that position and working for a hospital system. I worked for Cleveland Clinic, and it was a great fit, and I really enjoyed my time there. But then when my husband's fellowship was over and we had a baby, then we decided, okay, we need our family support, and the village that has, helped us survive.
Sure. So it's interesting. Those first few years, they're almost like they're intense in what you just described, but it gave you so much experience. Then
and I also found the culture is different in different states because, I felt in Ohio, there was the primary care pediatrician really managed everything. And, in New York, I feel like there's a little more, patients want to see the specialist and all of that. So when I was in Ohio, those first few years, it was just like, see everything, do everything, manage everything. And it set me up to be able to do all of that. So,
So how'd you get interested in lactation?
So when my first job out, I worked with a breastfeeding medicine physician at the private practice that I was at. I knew nothing about breastfeeding coming out of residency. Absolutely nothing. I was like, it's better. I don't know why. I think it's better. I'm not sure.
There's so little training on that. We have to fix that. We'll have to have a whole other talk on that, but
right. Oh my goodness. So much to say about that. And I worked with, this amazing breastfeeding medicine physician. And I really started to get my interest a little bit, but also I was so just learning everything about being a pediatrician that I kind of had a taste, but not a lot. And then with my second child, I had significant breastfeeding issues because of something. He had a really little setback chin, and there were a lot of latch issues and weight gain issues. And I kind of went all over the place looking for help. And I went to everyone I could think of, and we spent so much time on it. But in that process, I learned so much. And so after that experience, I was like, this is something I really want to know more about. And I want to be able to help other moms and parents with this. And then I also felt like I learned so much in the process that it just made me want to give that information to somebody who was struggling.
I feel like that's how all of us that go into breastfeeding support get there. Like for me, when my daughter's now 23 years old, but when I had her, similar, they sent me home from the hospital, and I thought, the pediatrician, no problem. She was jaundiced. She couldn't feed. I couldn't do it. I was online. There wasn't easy access to information as much as there is now. And I'm crying. And if I can't, it was so disheartening. But at the same time, it actually was a good thing it happened because it sent me down that path to then get
Absolutely.
that training and bring it to all of the new moms. And it gives you so much compassion for them. Like there's
Yeah.
so much more to it.
And I share a lot with patients of just, and that this was not easy for me. I get it. And it's a process, and it's not something that always just like clicks right away. And I think families appreciate hearing that it's, even for a pediatrician, this was not just second nature and,
Right.
super easy. And,
Yeah. All right. So tell us what happened to you.
yeah, that's a story. I was back at work about 6 weeks after maternity leave with my second child. So it was a rocky maternity leave because of all the breastfeeding issues. And we finally got it down, and I was like, all right, I'm back at work. And so I was back at work about 6 weeks. I was really, burning the candle at both ends. This was now second baby. So first time I was kind of managing two kids at home, all those challenges. And, I'd come home from work and I had the two kids to manage. After they went to sleep, I was doing all my charting, waking up multiple times a night to nurse, cleaning the pump parts, doing the whole thing. And I was really, not getting a lot of sleep, but I also felt like this is what happens when you go back to work.
You went back at 6 weeks?
No. I was back at work for 6 weeks.
Oh, okay.
Yeah. So my son was about 6 months. So I took like 4 months off.
Yeah.
And then
Yeah,
I
we
had
used to go back at 6 weeks back when
I
that, yeah.
know.
But
I
that doesn't
know.
seem to be the case anymore. Thank goodness.
Thank goodness. I wouldn't have survived. But so this happened when I had been back at work for about 6 weeks at that point. And so I had kind of been dealing with a lot of those struggles of going back and how to manage home and work and getting all my work done and charting. And so I was feeling lousy for a few days where I just was like extra tired. I thought I was having some bad reflux. I was like, I'm clearly not eating right, taking care of myself. And then I was at work on a Friday, July 23rd, 2021. So this was a little over 2 years ago. And I felt like I was having like the worst reflux of my life. So I asked my medical assistant, can you go find me some Tums? And by the time she came back, I was like sweating and lightheaded. And I was like, oh, I must have COVID. Or, I had them swab me. I had them take a blood pressure and a sugar. And it was like just a really rapid like decline of feeling horrible. And so I had them call an ambulance for me. And I said, I can't drive myself to the hospital. Like, I initially called my husband. He was on his way. I said, call him, tell him to meet me there because there's no way I'm going to be able to go via car. So in the ambulance, I was like in and out of consciousness. There's a lot that I don't remember. Yeah. And when I got to the ER, they did an EKG and then they put me in a room. And, I think, this is a whole nother podcast, but a young female coming in with chest pain is often not right. taken very seriously. And sure. I was writhing in pain, and I was kind of in a room for 45 minutes without anyone looking at me until my husband went out, and said, she's in a lot of pain here. So, that's a whole nother issue, but I was having a heart attack. And by the time it was sort of figured out and labs were drawn, and then I turned into what's called an NSTEMI. I mean, as a pediatrician, we don't know as much about it, but it was basically like the mild heart attack and then it progressed to a STEMI, which is sort of the full blockage, and you have your ST elevation in the EKG. And they correlated with wall motion abnormality, and then, all chaos kind of happened after that. And they called a code H, and I went to the cath lab, and I was fully blocked in my LAD, with what they called like an eccentric clot. So there was just a big blood clot that was blocking 95% of my LAD. They put in a stent. And then I was, brought to the CCU, and I spent a week there, and I was considered in heart failure. My ejection fraction was down to 28%.
Oh, God.
And, it really unclear at the time why this happened. And so there was a lot of kind of reconciling what just happened, and not even really being aware of what happened. I was more worried that they were giving me all these medicines that it would make me have to stop breastfeeding.
Oh, well, that's amazing that you were worried about that.
Oh yeah. I was
Right?
like, I'm not taking that. And my husband's like,
Right. Yeah. Wait, we worry about our kids more than we worry about ourselves, right? But wait, if your husband wasn't there to
yeah.
advocate for you.
Oh, it was 3.5 hours from arrival to the cath lab.
Yeah.
And it was 90 minutes before anyone even drew a troponin or even had a thought about this could be cardiac. So, there's a lot of sort of women's cardiology that has its own issues.
So who knows what this was, you were hyper. So then what happened? I mean, without trying to get to why it happened, how did this impact you and sort of your career trajectory?
Yeah. So, it was definitely a process to kind of understand and allow myself to take some recovery time because I was, the next day in the ICU, I was charting and finishing my notes.
Oh my gosh.
There's a whole mindset change that's required. So, I went home after a week and I was wearing like an external defibrillator. I wasn't allowed to lift my 6-month-old baby for 3 months. I wasn't allowed to drive. Like there was a lot going on there. And I had to really come to terms with life being very, very different. I told my supervisor I'll be back in 2 weeks, and then 2 weeks passed, and I sort of over time had to come to the realization that going back to work in the way that I was working is going to have to be very different, and life for me is going to have to look very different than what it did prior to this. And it was not a fast change in my brain. It was really like, I almost had to have an intervention. Like my husband was like, listen, like, we have to look at our priorities here. You're so trained to like, no one ever wants to take a sick day in medicine. No one ever wants
your
to
husband's a doctor as well, correct?
Yeah.
So he gets that mindset.
Yeah. And, of course, our parents are, they're ready for me to just be like, you're never working again. And
right.
But my husband understands that there's, you've trained for so long, you've put so much into this, and this is also a part of your identity and what you care about and what you want in your life and career. And so I was really sort of forced to sit down and take a look at how could I be a pediatrician, be a physician, also be a mom who's alive and well for her kids, and make it work. And so it took me, and also at the same time, I was traveling around the country, seeing all sorts of specialists to figure out how this happened, why this happened, what was the cause. And, went to the Mayo Clinic, I went to Cleveland Clinic, I went all over. So I decided that, I'm off. This is sort of the first time in my, since, college that I had some time. And I decided, let me get my IBCLC because this is really such of interest to me. And I also in the back of my mind kind of knew that maybe this was the path that I could take to slow down a little bit in the pace of how, you work. And then also be able to do what I love and balance everything.
Yeah. Amazing. Really. And then, So you went and you became an IBCLC, and much to my luck, the place you were working at, they put some resistance up. So tell me then what happened. Like,
yeah, so it was, probably close to a year out, and having sort of recovered to a point where I knew that I could possibly function as a physician and a mom and kind of get back to life a little bit, but also being fully aware that I had nowhere near the strength that I had prior, and also knowing that I still had a lot of health things to kind of work out. So I approached my former employer and said, I'm looking to maybe come back in a very part-time way, and see how I do. And I brought up kind of seeing general pediatrics patients at a slower pace because, as many, people in the field are familiar with, primary care pediatrics is very fast paced. We see a lot in an hour to try to, survive as, because reimbursement's very low for pediatrics. And so, I knew that I could not see as many patients an hour.
Why? Because your ejection fraction was like in the toilet. I mean,
it had recovered a lot. But what had also come to be revealed was this was due to most likely coronary vasospasm. It's kind of like Prinzmetal angina, and microvascular disease, which is not well known, in addition to probably a hypercoagulable state, and all the things kind of lined up in a row. And I knew that when I was rushed or stressed, it triggered the vasospasm, and I could feel it. And I was taking a lot of nitro, and I knew that I had to sort of find a way to do this that was safe for me. And so I brought up kind of, can I work at a slower pace with, of course, a lower salary to compensate, but can I see fewer patients an hour and maybe incorporate some lactation, because those are typically longer visits and allow you to move a little bit at a slower pace. And, the answer was no, pretty plain and clear. Like, we can offer you that you work at reduced number of hours, but your pace has to be the same. And, that was sort of shocking to me at first. And I was kind of hurt. This is medicine. This is pediatrics. How do we not understand what somebody is dealing with and going through? And I get it. It comes down to numbers in the end. But there wasn't even like an entertaining of being able to do that. And I even went through the disability office to see if there was other options for me. But ultimately, if a department claims, financial hardship as a reason for not being able to make disability accommodations, then there's really nothing you could do past that. So that's when I kind of said, all right, well, I need to explore other options, because I can't do what I used to do.
Right. It's the mindset, when you're in a large institution, you really can't be flexible like that, which is a shame. But I get similar to how we treat our kids sometimes. You think everything needs to be equal. And, if one person is working at this pace, maybe it's not fair for the other person to be working at a different pace. But, I always feel like everyone brings different strengths to the table. And as long as if as a group we're providing everything that we need for our patients, if one person wants to move 100 miles an hour and see all the sick visits, another wants to spend time doing the mental health and the breastfeeding, like, we can sort of like create kind of a mosaic with different people's skill sets. And so it's really nice that you were able to do that at our office. But I've seen you put a nitro under your tongue from time to time at work, so.
It's now in a spray, which is, I didn't know about, and it's fantastic. It's like Oh
boy. So let me ask you, if you know, if this didn't happen, right? Where do you think you'd be? Where do you like?
I was thinking about that, and I think, I think I'd be where I was. I think I'd be working where I was, and there were some benefits like loan forgiveness that you kind of put in your 10 years, and maybe I would have shifted after that. But I think there's a lot of this mindset of this is the way medicine is, and everybody works this way, and if everyone else is doing it, you can do it. And it takes a lot of also bandwidth, which you don't have when you're working so much and raising a family and doing everything, to kind of figure out if there's another way to do this.
Yeah.
And I think, medicine has become very like, everybody sees the same amount of patients and does the same amount of work. And it's a lot of not letting your team down and pulling your weight. And, that is ingrained very early on. And I think, the thought of possibly leaving a situation that, is probably not working for you, but requires so much effort to do that, that you just kind of stay on the hamster wheel,
Yeah. Yeah. All right. So let me ask you, what advice can you give to people to try to adopt some of your sort of mindset shifts without having to go through having a heart attack?
Yeah, wouldn't recommend going through the path that I did.
Yeah.
But I say there's really been an incredible amount of silver linings to what happened to me. It really forced me to stop, think about what I was doing, look at things in a different way of how can I be creative, and how can I figure out a way to be well for my family, and for myself, and well enough to practice too, because you can't be a physician if you are not doing well yourself. So I think my advice would be to take a step back at times and try to put some of that mental effort into how you can make things work better for yourself. If you find that you're going towards that burnout, and it's hard to even realize it until you're there, how, sort of being a little bit creative and how you can change things and maybe practice medicine in a way that works for you now. I mean, it can always change. I always say, like, when my kids get older, maybe I'll have more energy to take on more. And, there's so many things I want to do and accomplish. And your brain starts going to, I want to do this and I want to do that. And, and then sort of realizing, okay, like, take it down a notch. Like, your kids are little, like, you can accomplish these at some point. But it's a process. And I think, it's important for everybody to just take a moment to look at how they're doing, and if their life is kind of how they had planned, and whether they need to pause and maybe make some changes.
Yeah. Did you have any help from a therapist or a coach or anybody, or were you able to go through that work on your own?
So I didn't, and I think what allowed me to figure it out was that I was not working. And I had a lot of time with my own thoughts. Yeah. And I also didn't have a choice. So, like, if I was physically able to go back, I would have. That's the path of least resistance, okay, back in the job that's waiting for me. Just go on, back on the hamster wheel. But I didn't have a choice. And
so you really had the forced stop. But I guess the advice is to sort of take a planned pause and intentionally. Yes. Got it. Okay. Yes. All right. So listen, I am so grateful that Facebook connected us.
Yes, me too.
There are some benefits to social media, I suppose.
Yes.
So Jessica, thank you so much for being here today and for all that you do. And I want you to stay healthy.
Yes. And I thank you for allowing me to share my story and whatever advice I can give. And, if any listeners are going through a time where they feel like they need help making some change, like I'm happy to discuss, sort of and some of the advice that I can give.
Yeah. Well, how would people find you if they wanted to take you up on that kind offer?
So I guess I can give my email, right?
Sure.
Okay. So it's jcohn, Cohn, at alliedphysiciansgroup.com.
Awesome. All right. Well, thanks again. And I will see you at the office.
Yes. See you soon.
That's all for this episode of Reinventing the White Coat. If you enjoyed this conversation, subscribe now so you don't miss an episode. If you're interested in coaching or in being a guest on the podcast, you can reach out to me online at sharecoaching.com. Thanks for listening, and don't be afraid to live your best life.